Start recording. Alrighty. So as I said, we have a lot of stuff coming up fairly quickly, but the good thing is spring break is in 2 weeks. So once you kind of get over this hump of everything that you have going on, you hopefully have some time to relax or at least not have to worry about class too much and rejuvenate so that when you come back after spring break, you maybe are feeling a little bit refreshed. I don't know, maybe that's hopeful given that we're still in the middle of a pandemic, you're all still working, you all still have family stuff. There's still a lot going on outside of your classes and everything too. I know a lot of times for spring break, I use that time to catch up on all the things that I've fallen behind on that I can't do during the semester time when I'm teaching or have meetings or other stuff going on. So a few things for class. As you all know, our midterm is next week. So it starts on Wednesday, the 17th at 9:30 a.m. and it closes on Thursday, the 18th at 11:59 p.m. So the purpose of today's class is going to be mostly to just review for the midterm, go through some sample problems. I'll go through some slides to help you kind of focus your studying and pinpoint the areas where I think you should focus and kind of tell you some of the areas that maybe not focus so much on on certain things because they're not going to necessarily be tested in a way that you really need to focus on them while you're studying. So let me just pull up some PowerPoint slides. So everything that I'll go over today, I did post on Cougar Courses. So you can go there and you can download the review slides. The one kind of caveat I always say, so the review slides that I will go through today, they are, what I did is I pull slides from all of the other lectures in the class. Just because I'm going over only this particular slides does not mean that this is all you are going to be tested on. So you still have to make sure you're reviewing the other content that I'm not covering today, but we've had 6 weeks, 7 weeks worth of material. So it's impossible for me in a 2-hour review to go over all of that material. But like I said, I will pinpoint the areas to help you focus your studying so that while you're going through it, you're not trying to review 6 weeks worth of recorded lectures and PowerPoints and live sessions and everything to make sure you do well. But rather you can pick out those areas that you're maybe having a little bit harder time with and that I can say, yes, you're definitely going to be tested on this. Make sure you know how to do this and that you're comfortable doing these types of problems. So before I do that though, so as a couple of announcements, as you all know, you've had 3 homework assignments assigned. The hard deadline for all of those is the midterm date. So next Wednesday at 9:30 a.m., you should have all of your homework assignments submitted on Cougar Courses. And they need to be uploaded there. If you think you're going to have trouble getting those submitted or working through them, please let me know this week. I don't want to hear on Tuesday that you're not going to be able to submit them. I've been keeping up to date on Cougar Courses and most people have submitted homework 1. About half of you have submitted homework 2. And then obviously homework 3 has a goal deadline of this Sunday. So I don't believe anyone or maybe 1 or 2 people have submitted homework number 3 at this point. The other thing that's important too is the questions on the homework assignments. Those are very similar to the types of questions that you will expect to see on the midterm exam. So for example, homework number 3, there's a short answer problem where you have to do a calculation for a cross-sectional study. You will receive a short answer problem that is very similar to that on your midterm exam. So doing the homework assignments is very much studying for the midterm exam. So make sure you're working through those while you're reviewing the material. And if you have questions that come up about anything on the homework, let me know and we can meet to go over them. And I'll go at the end if we have some time or if people want to stay over once we're done. I'm happy to kind of pull up some of the first and second homeworks and go through any questions that you have. I'm working on grading them all right now, and I'll hope to have all the grading done by Friday so that you all have, at least if you've had it submitted at this point, I'll have it graded by Friday so you know whether or not you got the answers correct for those homeworks too, so you can use those to study as well. So make sure you get those in. It is important. It is part of your grade. Each homework is worth 20 points. So if you're not submitting them, that's going to really hurt your grade, unfortunately. So again, reach out to me if you're struggling or you're not sure you're going to be able to get them in, so that we can come up with a plan to ensure that you're going to do well, not only on the homeworks, but also on the midterm. I already mentioned the midterm exam starts next Wednesday. The way it works, as I said last week, is it'll go live at 9:30 a.m. I will have a short live session. It'll be 10-15 minutes long. That'll just be a midterm is live. What last minute questions do you have? Here's where it is on Google courses. Here's what you're expected to do, and so on. Once you start the midterm exam, you will have 2 hours to complete it. So if you start the midterm exam at 9:30 a.m. on Wednesday, you will have until 11:30 a.m. on Wednesday to complete it, and there's a timer on it. It'll be designed to where it'll take you, or on average, the hope is that it should take students about 1 hour and 15 minutes to complete. But I know sometimes in this online environment, things do take a little bit longer. There will be problems that you will have to complete, and you'll have to show your work for those problems. The way that I do that is you can either do the work on your computer on a Word document, or you can do the work on a piece of paper, handwrite it out, and then you'll either take a picture or upload the doc, or create a PDF of the document that you do on your computer. And there'll be a separate section on Cougar Courses that you'll submit within 15 minutes of completing your exam. So what that means is if you complete your exam at 11:30 a.m., you have until 11:45 a.m. to upload the work that you did for the questions that require work. And I'll always say, please show all your work for these problems to receive full credit. That's for multiple reasons. One, because I want to make sure you actually use the right formulas, went through the steps that are needed to come up with the right answers. But more importantly, if you come up with the wrong answer, I want to be able to give you partial credit. And I cannot give you partial credit if I don't know what you did to come up with the answer for the problem. So if your answer is just 32, and I don't know how you came up with 32, and 32 is wrong, you'll get 0 points for that. If your answer is 32 and you show me the steps that you came up with to come up with 32, likely you'll get about half points for something like that, so long as the steps make sense and you're just not making things up off the top of your head to get points. So make sure you're showing all your work and that you follow those instructions on Cougar Courses. They'll be pretty clear when you go to the exam section, and we'll talk about that next week as well. The other thing for the midterm exam is always on the midterm exam, I have like a short answer essay question, and I've traditionally just had that be part of the exam itself, where you see that short answer once you open up the exam. But I know that that can be challenging to write a couple of paragraphs during a time when you have a time limit. So what I did this time, and I'll show you the prompt, this is posted on Cougar Courses already, is I wrote up essentially a short prompt. It's a little bit longer than it would have been if it was just on the exam itself, but the idea is the same, where this is a question for your midterm exam. The reason I do these types of short answers is because for some of the concepts we learn about in class, I can't just ask you a multiple choice question about them and have it make any sense. So essentially with this prompt, what you are required to do is write a 2 to 3 paragraph response, no more than 1 page. So it's fairly short. What you do is you choose a health outcome. That could be diabetes, that could be cancer, that could be mental health, that could be HIV, that could be anything that you are interested in. You first describe what health disparities are and what social determinants of health are, and you use language from the class and what we've talked about in lectures. Then you describe the epidemiology of the health condition. So because I'm giving this to you early, that means you do have to use sources like the CDC or others to say, if you're looking at HIV, who's infected with HIV? What's the prevalence? What's the incidence? What are differences by racial ethnic group? What are differences by LGBTQ status? And so on. So you have to give a short description of that, just a couple of sentences of what is that descriptive epidemiology of the health condition that you have chosen. Then you have to talk about health disparities. Do they exist? Why do they exist? So for example, if you choose HIV, we know that there are disparities in HIV infection by LGBTQ2S status. So people who are a sexual and gender minority are more likely to be infected with HIV. So you have to describe that and then talk about why. What is going on and why do we see these disparities in the disease? And then what can we do to prevent those disparities is the last part. And that what can we do to prevent them? Those can be your own ideas. So if you've seen things happening in your work or other places where, and we've talked about how like discrimination affects health and other things, I'd like you to bring some of those concepts in. Say, well, one thing we need to do is address discrimination certain groups face. So if someone is a sexual and gender minority, they often face homophobia, transphobia, and other discrimination that impacts their health. And so in order to address these health disparities, we need to address the discrimination that these groups face to improve health equity. So you just you have to write up 2 to 3 paragraphs to kind of describe the epidemiology, the health disparities, and what we need to do. So that is one of your midterm questions. There'll be a question on the midterm on Cougar courses where you'll take whatever you write up, and I encourage you to do so early so you're not spending your time on the midterm itself, and then you'll just paste your answer into that question onto the midterm itself so it's submitted with the rest of your midterm. So are there any questions about the midterm, about this prompt, about what you're expected to do in this next week to do well in the midterm before we go into the review and everything? The midterm will be about 15 to 18 multiple choice / true false questions. And then probably 4 short answer questions, with one of those 4 short answer questions being that prompt that I just showed you that is already posted on Cougar courses. The other short answer questions will be calculations, and we'll go through similar calculations today. So the other thing for the midterm is I posted on Cougar courses and I sent you all an announcement about it. There are additional review sessions aside from today. So tomorrow there is a review session, Friday there is a review session, and Monday there is a review session. Obviously, these are all optional. That is just me making myself available to answer any questions, go through sample problems, talk about the prompt for the midterm, or whatever else you might need help with to ensure that you do well on the midterm itself. So if you're able to make any of those additional review sessions, there's one tomorrow from 1 to 2 p.m., one on Friday from 11:30 to 12:30, 11:30 a.m. to 12:30 p.m., and then one on Monday from 3 to 4 p.m. And obviously, if you can't make any of those review sessions and you have questions, you're always welcome to join office hours, or you're always welcome to email me or to text me to ask questions and to jump on a Zoom or a phone call to get answers to any questions that you might have. I try to make myself as available as possible during the week before the exam so that while you're studying, you can get answers to questions and do well on the exam. The other thing that I do too, I've already sent you all my cell phone number, but I'll post it again next week. Because during the midterm exam, one of the things I hate about this virtual environment, I like that you guys have flexibility to take the exam over 2 days. What I don't like is that you're all taking it at a different time. So if you have a question about one of the questions on the exam, I'm not there specifically to answer that question. And I don't want any confusion about the particular question to lead to you getting a wrong answer. So I do give you all my phone number so you can text me. If you're working on the exam and you text me, generally speaking, I see my texts immediately because they pop up on my computer. So as long as I'm not in another meeting or doing something extremely important, I will respond as quickly as possible. And if need to, we can jump on a phone call or we can jump on Zoom so I can answer your question quickly so you can move on in the exam. That being said, if you text me 5 minutes before your exam time runs out, I will likely not be able to get to you in time to be able to answer your question. So what I recommend is that you kind of go through the exam early think of any questions that you might have and let me know within the first hour. So then that gives us a whole hour for me to be able to respond and jump on a call to be able to help you with it. That all being said too, that is between the hours of like 8 a.m. and 10 p.m. If you take the exam at 1 a.m. and you text me, I will not be responding to your text message and jumping up on a Zoom to answer your questions at 1 in the morning. So just, you're welcome to take it in the middle of the night if that's what you prefer, but I won't be available to help you with anything if questions come up, because I'm not going to wake up at 1 a.m. to answer questions. That's where I draw my limits between 10 p.m. and around 7:30 a.m. so that I can actually get some sleep. All right, so there is class next Wednesday, but as I said, it's not required. It's just a quick launch of the midterm, answer any last minute questions. It'll be 10 minutes, jump on Zoom, answer any questions you all have. That's it, you don't have to come. It's all up to you. So what questions before I jump into the review? Cool. So as always, feel free to stop me, feel free to send me messages. And I'm realizing here, I just opened up the chat. I don't know why it's defaulting for you guys to only be able to chat with me, but it's opened up so you could chat. So if you have questions while I'm going through things, feel free to send a message, unmute yourself, and ask questions, whatever that might be.
Oh, I'm sorry. Yeah. I just had one really quick question. When was the final project due again?
So the final project itself, so I was just going to quickly mention that. The final project prompt is posted on Cougar Courses already. Don't worry about it too much before the midterm, because you have the midterm to study for next week. But I do want you all to at least look through it before our next live session, because there is the final project you'll submit in 2 parts, and this is all posted in the prompt. The actual final product of the final project is not due until the last week of the class, but you have to submit like 1 page of it in about 3 weeks. So I believe it's like a week and a half or 2 after the spring break. That kind of identifies your topic and talks about some of the background of your topic. So make sure you're looking through that and asking me for any questions that you have. So that's posted separately in a separate section on Cougar Courses. The other thing that I wanted to briefly mention that we can talk about after the midterm and spring break too is I am thinking about changing the format of the final exam. So the midterm exam, as you know, it's going to be on Cougar Courses. There'll be multiple choice questions. There'll be short answer questions. Normally, I do a final exam that's very similar. What I'm thinking about for the final exam is actually having it be more open, where you'll have to, so I'll give you 5 different topics and prompt questions that you'll get about 2 weeks before we would actually have our final exam date. And you would choose 3 of those and either record a video, and that would be the ideal, or come up with a short presentation of you describing those concepts in epidemiology to your family or to the lay public. So what do they mean? How do we use epidemiology? So that might be something like, describe the differences between the different types of studies we've talked about in class. And so then you would come up with a short 5-minute response to that that says, these are the types of studies, this is how you use them, this is what type of evidence we have from them. And so what it would be, instead of you answering a multiple choice question, it would be you taking what we've learned and trying to be able to explain it to someone else outside of this class. So I'm thinking about doing something like that, but I want to get your feedback on that before I change that format of it. So I wanted to kind of talk about that now briefly, and then we'll talk about it more the first class after spring break. But it just allows for more flexibility, and it allows you to actually apply what we're learning about and take the concepts that maybe you're even most comfortable with and say, of these 5 concepts, and they'll probably be something like study design, causality, screening, health disparity, social determinants of health, and one other that you'll have prompts for. You would choose 3 of those 5, and you'd be required to do like a 5-minute video for each of those 3, describing those concepts to the lay public. And that would end up being your final exam instead of a 2-hour exam, multiple choice, and so on. So I do want to get your, if you have any thoughts on that, feel free to email me. I don't want to spend much time on it now because I want to review, but we'll talk about it at the end of this, at the first class after spring break as well. So, all right. So let's start with the review. And again, feel free to chat in, feel free to interrupt me anytime. This first thing that I'm going to do, these are the PowerPoint slides that I have posted on Cougar Courses. I'm going to go through these fairly quickly. I'm not going to reteach most of the concepts or talk in detail about most things, because the goal of me going through these PowerPoint slides is to help you focus where you need to study and what you need to know to do well on the exam. So obviously, we're in an epidemiology class. You need to know what is epidemiology. You need to be able to describe the purpose of epidemiology and how it's used to understand the distribution and determinants of health, related states or events in human populations, and to apply that to prevent and control disease. So you do need to know, I'm not going to tell you to write down the definition of epidemiology because you're all going to have it right there. You'd be able to copy and paste it directly from a slide, so that's not needed, but you at least need to be able to explain those concepts. You need to be able to explain why epidemiology is the foundation of public health. And it is because it addresses the assessment of the health of the community, it's used to develop policies, and it assures people the services that they need by addressing health disparities and social determinants of health to ensure that they can live a healthy life. So you need to know why epidemiology is that foundation and how it addresses those core functions of public health. And this is all from the very first lecture. And so here's that slide. There's a specific slide in the lecture that says, this is why epidemiology is the foundation of public health. So know this, you'll be tested on this. And then those core components of epidemiology, you need to know what is endemic. Endemic means that's that normal state of disease. So meaning that the disease exists in the population. It regularly spreads at a certain rate every year. Endemic can move, and endemic can also mean that it doesn't exist, right? So the disease is not endemic in that population. We don't see it normally spreading. Endemic, as you see in the figure, becomes epidemic when we see an excess number of cases. So what an epidemic is a higher number of disease occurrence than we would normally expect to see in that particular population. So if we normally have 1,000 cases of chlamydia in San Diego County, and this last 3 months, we've had 4,000 cases of chlamydia, that would likely be considered an epidemic of chlamydia because the number of cases has increased much more than what we would expect to see in the population for that time period. What is defined as an epidemic actually varies from disease to disease. So for example, if we're talking about something like measles, where for the most part, we've curbed the spread of measles through vaccination, that as we see more vaccine hesitancy and less people getting vaccinated, we're seeing more and more outbreaks or epidemics of measles, where even just 5 or 10 cases of measles in a given area might be considered an epidemic because they would normally see no cases, and measles can spread fairly rapidly. So we want to consider that to be an area of concern. And then pandemic is an epidemic occurs that across many different populations or even the entire world, such as the COVID-19 pandemic that we're currently facing. Make sure you know those two core components of epidemiology. What is distribution referred to? And that is the who, when, and where. So what is the frequency and the pattern of health events in the population? And how do we use that to describe disease in the population and understand health disparities and so on? And then determinants are the actual what leads to health outcomes. What causes lung cancer? What causes HIV? What causes COVID-19, the disease, and so on. So make sure you can define what determinants are. And then what we'll talk about in a little bit, because we expanded on this in terms of disease causality in the lecture we had a few weeks ago, where we talked about causal inference and making a conclusion about the presence of disease. So do we know if that determinant is actually causal? Make sure you kind of understand those concepts to be able to answer some questions about them. And I'll show you some sample problems about those. Oops, wrong way. And then make sure you know the levels of prevention. So there's primary, secondary, and tertiary prevention. And this is part of public health. This is part of epidemiology. Ideally, the goal is primary prevention, where we prevent disease before it happens in the first place. That means that we are limiting exposure to the SARS-CoV-2 virus so that people are not getting infected with it. Secondary prevention means that we are doing screening and detection of disease. So if someone is potentially exposed to the SARS-CoV-2 virus because they come into contact with someone who has it, then we want to be able to get them tested early so that we can detect whether or not they were infected with that virus, and then put into place the proper mitigation strategies to not only prevent them from passing it on to other people, but also to prevent adverse health outcomes from it. So secondary prevention is screening for the disease and early detection to prevent adverse health outcomes. And then tertiary prevention means that the person has it, they're exhibiting symptoms of it, and now we want to limit disability and improve quality of life. So for example, if someone has diabetes, we want to engage in tertiary prevention to ensure that they're taking their medication properly, that they're monitoring their blood sugar, and that they have a good quality of life, and limiting things like diabetic ketoacidosis, diabetic neuropathy or retinopathy, or even death as a result of uncontrolled diabetes. So tertiary prevention is that a person has disease, let's prevent adverse outcomes and further disability and lower quality of life from that disease. There's the two areas of epidemiology. Know the difference between descriptive and analytic epidemiology, with descriptive being to characterize and summarize, analytic being to compare and to understand determinants of disease. And so then that was really week one. We moved into week two. So week one was all about what are the core components of epidemiology? What's that foundation you need to know to understand to move forward? Week two was all about measuring health and disease and measuring morbidity and mortality. So make sure you know what surveillance is, that ongoing systematic collection of data to understand the health of the population, to allocate services, and make sure you know the two types of surveillance. What's the difference between passive and active surveillance? So active surveillance being that there is actually health agencies who are actively contacting people and health organizations to get cases of disease. Passive being that that people are just reporting up by healthcare providers, and that there's no active collection of that data. And then of course, we talked about all of the different measures of morbidity and mortality. And this was week number 4, I believe, in the class, where we have these 4 measures of mortality: annual mortality rate, specific mortality rates, case fatality, and proportionate mortality. And then we have prevalence and incidence that you all may be expected to do calculations for. So make sure that you are comfortable doing those calculations. You have the formula sheets that gives you all of the formulas. You also have all of the formulas on the PowerPoint. So if you want to organize the formulas in a different way than what I've provided them to you, that I would recommend that you do that, and you set them up in a way that is understandable for you, so that when you get to a calculation problem, you can easily identify the formula you need and plug in the numbers that you need to plug in to be able to do the calculation and interpret the answer. Remember, the most important thing here is figuring out what numbers you need to plug into the formula. So I'd recommend going back to homework number 1. And as I said, I'll have homework number 1 graded this week so that you know whether or not you got those correct. Going back and looking at those problems that you answered on mortality rate, proportionate mortality, case fatality rate, and what numbers you plugged them in and why you plugged them in and what your answer was, because you will have to do similar things on the exam. There'll be a few problems where it is a scenario and it'll say, calculate the crude mortality rate for this disease. What is the proportionate mortality rate for this particular disease. So make sure you're comfortable with that. And then there was incidence and prevalence, our measures of morbidity. You'll again have the formulas. So you all have to do calculations and interpret what those calculations mean. As I've mentioned before, and we will go through a sample problem on this, you are going to receive this figure. What will be different is these red lines will be different. The arrows will be in different places. So the number of person months will be different. But you are going to receive this exact same scenario with just the lines in different places. And you are going to be asked the questions, what is the prevalence of disease on one of these 3 dates? What are the number of person months contributed by the people in this population? And then what is the incidence rate from October 1st to September 30th? That will be on the exam. You're going to see this figure. You're going to have to answer those 3 questions. There is this same problem on your homework, number 1 or 2, I forget. There is this same problem on the sample problems. There are about 3 recordings where I walk through this sample problem, and I will go through one of these problems. Well, you'll work through one of these problems first, and then we'll go through it and we'll talk through the answer together today. So ideally, by the time the midterm happens, you will all feel 1000% comfortable seeing this figure, coming up with a number of person months, and doing those calculations. If you do not, after this review, and you're studying and you're not sure how to come up with the answers for this, I beg of you to reach out to me or to reach out to your other friends in the class or people in the class to get your questions answered. It's going to be about 10 or 15 of the 100 points on the exam. And because you know it's going to be on there, you know that you have to study this and that you're going to see this. So please, please, please make sure you understand it. I cannot emphasize that enough, because every semester I say this, and then I have 5 or 6 students who after the exam, I did not know how to do that one problem with that figure, and I didn't know what it was. And so I cannot emphasize it enough. You all that are here know, I'll say this in an email, I've said this previously, so make sure you know how to do it. Make sure you understand the relationship between incidence and prevalence. So what factors increase prevalence? What factors decrease prevalence? What factors increase incidence and decrease incidence, and so on? What does it mean if your incidence and prevalence are similar to each other? What does it mean if your incidence of disease starts to go down? So on. There's stuff in the lectures about those. We'll go through some sample problems on that as well. And then we moved into, and what I'm skipping right now is the social determinants of health and infectious disease epidemiology, because I'll talk about those at the end. We moved into disease causation or causal inference. So causal inference, make sure you know in general what causal inference is. It's a conclusion about the presence of a health-related state or event and the reasons for its existence. And this is determined through study design and that rigorous process that we use through multiple studies to determine how some behavior or exposure is associated, or some determinant is associated with some health outcome. We have this sufficient component cause model that has the different components that talk about what is necessary, what is sufficient, what is just a component of each disease, and how do we use that to understand how people develop disease. And then we have the types of causal associations that we went through. And I have a couple of sample problems today where you'll read through scenarios to talk about what is a necessary cause, what is a sufficient cause. And this can be broken down into 4 different components. So necessary means that in order for the disease to happen, the cause must be present, that determinant must be present, but there could be other causes of that disease as well. Sufficient means that if that particular determinant or cause is present, the disease is going to happen. But there may be possible that there's other things that can lead to that disease too. So we can break down this necessary and sufficient into 4 different causal relationships. necessary and sufficient, meaning that if the cause is present, if the determinant is present, the disease is always going to happen. Necessary but not sufficient, meaning that in order for the disease to happen, the cause must be present, it's necessary, but just having that cause present is not enough to lead to disease. Something else must be at play. Sufficient but not necessary, meaning that there could be a potential cause that could lead to disease, but there are multiple other causes that can lead to that same disease. So while that one determinant or cause can lead to disease on its own, so can others. So it's not necessary for it to be present for the disease to happen. And then lastly, neither sufficient nor necessary, meaning that that particular determinant or that particular cause, and it wouldn't even be considered a cause, is not needed for the disease to happen. And this is the case with most chronic diseases, where someone does not necessarily need to be physically inactive to develop cancer. And that's not sufficient in and of itself for cancer to develop. But we do know that physical activity can reduce risk for cancer, but physical inactivity in and of itself is not necessary nor sufficient to lead to cancer. So I do realize this lecture, this component of the class is the most confusing, because this is a whole new way of thinking about why diseases occur and what we need to do in research to examine the different factors that can lead to different health outcomes. So this stuff will take you a while, and it, even after the midterm, we'll still talk about these things as we talk about the different study designs, but it will take you a while to kind of fully grasp these concepts because they are difficult and they're a new way of thinking about research and disease causality. And then how do we determine disease causality? And that is through study design. So we have so far talked about 4 different types of studies, or really 3, since case reports and case series are related to each other. So make sure you know the differences between a case report, a case series, a cross-sectional, and an ecological study. What defines a cross-sectional study? What defines an ecological study? What is a case report? What is a case series? You need to make sure you know that, and you can kind of identify those major components of these types of studies and what they mean for disease causality. So remember, a case report is a profile of a single individual. Case series is a small group of individuals that all have similar symptoms or a similar diagnosis, and they're good for hypothesis generating, but they're not good for causal inference. Ecological studies are observational studies that are defined by the fact that data is collected at the group level. And these are the major points of ecological studies. And we have this major problem with ecological studies that we call an ecological fallacy. And that is where observed associations at the group level do not necessarily equate to individual level associations. So what that means is that we cannot collect data from entire populations or from a group and apply that information to individuals in the population, because we don't know whether or not the same individuals are the ones who are reporting the health outcome and the exposure are the ones that are actually getting the disease and seeing that outcome. So that's a major problem with ecological studies, and they're hypothesis generating. They don't tell us much about causal inference, and so we need to be careful about how we interpret results from ecological studies. And then cross-sectional studies, these are also called prevalence studies, and these are the types of studies where we collect data at one point in time, typically using a survey, and we ask people about their exposure or their determinants and their health outcomes at the exact same time. So on a survey, we might ask people, how often are you physically active? Have you ever been diagnosed with type 2 diabetes? We would examine that data and see whether or not people who are less physically active are more likely to develop type 2 diabetes. And so that is data collected at the same time from participants at one point in time. That is also good for hypothesis generating and determining associations, but correlation or association does not equal causation. and we don't know anything about the temporality or the timing of the disease with the behavior that people are reporting. So for example, what if people who were told they were diabetic started exercising more to treat their diabetes? Then now we would actually see what we call reverse causation, where it would actually look like people who exercise more are more likely to develop diabetes on a cross-sectional study because they started exercising more after they were diagnosed, not before. So that timing of when exposures or determinants are happening and disease is happening is extremely important for determining disease causality. The other big thing with cross-sectional studies is we can calculate prevalence of disease, but we cannot calculate incidence of disease because we're only collecting data at one point in time. So make sure you know those major differences between the types of studies, when they're used, how they're used. And then this is the slide that's on there. What can we say about causality from descriptive epidemiology? It allows us to develop hypotheses about where we need to do further studies. It allows us to determine probable causality, but we need to do future and further research to better understand that. And it allows us to do comparison across groups to understand where to focus our particular additional research. Then the other thing that we went over were measures of association. So calculating prevalence ratios and prevalence odds ratios. So make sure you're comfortable with those scenarios, creating a 2x2 table, calculating a prevalence ratio or a prevalence odds ratio, and we will go through a sample problem for that today. You will have at least one short answer problem that will be similar to the homework problem on homework 3, or to the sample problems that we went through last week, and to some of the sample problems that we go through today that are a scenario that say create a 2x2 table, fill it in, calculate an odds ratio, and interpret it. So do make sure you're comfortable doing that. And again, if you have trouble with filling in those 2x2 tables or the calculation, make sure you're reaching out to me or other people in the class to ensure that you know how to do that. And so this is kind of that 2x2 table where we have 2 rows and 2 columns, and the disease is always on top, exposure is always on the side, and you'll have these formulas. They're on your formula sheet, so make sure that's organized in a way that you can easily follow while you are going through the exam. So just make sure you understand how descriptive studies are used, what type of information we can get for them for determining hypotheses and disease causality, and how we can do measurements from them. Any questions about that part before I talk about infectious disease epidemiology and social epidemiology to end up this part of the review? Cool. All right, so social epidemiology, social determinants of health, the main way you're actually being evaluated on this part of the class is through that prompt that I already showed you that you have to work on between now and next Wednesday, or between now and the time that you start the exam. So really you have to know, what is the use, there might be like one question about the usefulness of social epidemiology and why we use it and how we use it. But really you're going to be defining social determinants of health. You're going to be defining health disparities using that prompt on that short answer question. And you're going to be describing health disparities for one particular health outcome that you're choosing. So the part from this part of the class, that lecture, and we've talked about health disparities and social determinants of health in almost every lecture throughout the class. Just make sure you're kind of understanding how they arise, how racism, hate, discrimination impact these things, so that you can discuss those in your actual 2 to 3 paragraphs, because I believe that those are important parts of health disparities and framing of how they arise, because they're not due to, most health disparities are not due to individual level differences in health or genetic differences in health. They are due to these larger structural issues in our society, and to things like discrimination and homophobia, religious persecution, and so on, that lead to certain groups having less access to what they need to be healthy. So make sure you're able to describe those in your short answer question that you already have the prompt for. And if you have questions about that, feel free to reach out. I'm not going to tell you whether or not what you're writing up is correct or incorrect, but if you have a question about whether or not what you're doing is appropriate, I'm happy to answer questions and say, no, I wouldn't go that direction. Make sure you provide these details or so on. But if you finish it early, I'm not going to read it and say, I would suggest these edits before you submit it on the midterm. So just make sure you're able to think through a lot of these issues and how we talked about them in class. Don't worry about allostatic load. Well, actually, there is some stuff about allostatic load in the recorded lecture. Know what allostatic load is, and that is this buildup of cumulative stress and how that can potentially alter things and lead to disease. So just make sure you know in general what that is. There may be one multiple choice question on that. And then lastly, the last thing that we've covered up to the midterm is infectious disease epidemiology. Your homework number 2 covers a lot of the main concepts in infectious disease epidemiology. So if you're completing homework number 2, make sure you know the things about why is it unique? What is different about infectious disease epidemiology than social epidemiology or other forms of epidemiology, in that, the cause is often known, that a new case becomes an exposure for other people, and there's often a need for urgency and so on. Make sure you're able to describe those things. Make sure you know what the epidemiologic triangle is, and it's that interaction between the environment, the agent, and the host, and how those things interact to lead to disease transmission. And that if we were able to intervene on one of these things, so we get rid of the agent, we would no longer have disease transmission. We get rid of a susceptible host by vaccination, we would no longer have, or we would minimize disease transmission. We minimize the environment that leads to the spread of that particular disease, we would curb the spread or minimize the spread of that disease. So know what this triangle is and how it's used. And then that kind of leads into this chain of infection, where when we're thinking about the spread of disease in the population, start out with a pathogen. We need to have some kind of human reservoir that can be infected with that disease. That human reservoir, in order for that disease to be able to spread to others, there has to be some kind of portal of exit. So typically that is our mucosal membrane. So that is breathing, sneezing, blowing our nose, defecating. So some way for that pathogen to exit the human reservoir and then transmit to another human reservoir that has a portal of entry, which again is typically mucosal membranes, mouth, nose, eyes. Could be genital region, it could be a cut in the skin or something else. And then that pathogen needs to be able to establish new disease in that host. In order for there to be sustained transmission of that pathogen, that needs to be able to happen on a regular basis. And so there is the different types of transmission. Know the difference between vertical and horizontal transmission. Know the difference between direct and indirect transmission and what that means for the spread of disease. And sorry, I don't know what happened to the slide. Know how we work to stop the spread of infectious diseases through testing, through isolation, through contact tracing, through quarantine and mitigation. So what are those main principles that we use to stop the spread of disease? And there's some information in the lectures. I showed you that kind of Swiss cheese figure of preventing respiratory infections that could help with some of this. And then lastly, know what an outbreak is. And an outbreak is basically an epidemic in a defined region. So sudden occurrence of disease. Don't worry about the 10 steps of an outbreak. There is a recorded lecture on outbreaks. We didn't really cover that much in any of our live sessions, and we haven't talked about it much. So do not worry about the 10 steps of an outbreak. Do not worry about memorizing those or anything. Just know what an outbreak is. It's basically an epidemic in one geographic region. And then that lastly, iceberg concept of infection, where active clinical disease only accounts for a small proportion of actual disease that we're seeing in our population. And there is a lot of invisible or asymptomatic infection that we're not detecting, either because we're not testing enough, people aren't seeking services, or for many other reasons. So, any questions? Hopefully that was helpful for pointing out the major things. I know it's a lot. We've covered a lot in this class, but hopefully that kind of pinpointed some of the main areas that you should focus on. What questions do you have about any of that? Y'all are quiet today. You're always quiet, but you're particularly quiet today.
I had a question.
Yeah.
It's about the necessary and sufficient factors. I don't know if you're going to go over examples or not.
Yes.
But I just had a question because on the homework, there was a question that said that age was a factor in one of the diseases. And I know age is a factor in like a lot of diseases, or it causes a lot of diseases. So like if age was one of the factors, would that always just be not necessary?
So let's think about that. So the question on that homework, and so I don't remember the exact wording, I don't have it up, but basically, from what I remember, the question is people who are older, or the kind of little scenarios, people who are older are more likely to develop chronic diseases. However, not all old people develop chronic diseases. Younger people also develop chronic diseases. What's the causal relationship between age and chronic diseases? So given that, is it necessary to be older to develop a chronic disease?
No.
No, right? Because the scenario says that young people also develop chronic diseases. Is it sufficient to be older to develop a chronic disease?
Yes or no.
So if someone is older, are they always going to develop a chronic disease?
Oh, no.
So that means it's not sufficient. So that means that it's neither necessary nor sufficient. And typically speaking, yes, that will be the case for age. Age is never really a necessary or sufficient component for most diseases. Age, as people age, or when people are, or when we have very young babies or infants, that does increase susceptibility to severe disease and disease in general. But that does not mean that that's only happening in those age groups, or that it is necessary or sufficient to be older for those outcomes to happen. So in general, age, while it is an important contributor to the development of disease, it is not a necessary or sufficient component of most diseases. It is rather just a component of the disease. So if we think about that causal pie, age would be a component of many people's disease, but not in everyone's disease. Because if we think about something like type 2 diabetes, we have children as young as 8, 10 years old developing type 2 diabetes, and we have adults all the way up to 70 developing it. But we have, that across that broad range. So kind of what you want to think about with some of those is like, how is this playing a role in the actual development of disease? Does that make sense?
Yeah, that makes sense. And then also for most chronic diseases, they're usually neither necessary nor sufficient.
Exactly. So for most chronic disease outcomes, the components of them, so the determinants, are neither necessary nor sufficient, because we have a multi-causal model where for diseases like cancer, for diseases like diabetes, I actually had a professor explain it to me one way in undergrad that was kind of unfortunately like the lottery system, right? And every exposure that you have is almost like getting a lottery ticket, but it's a lottery that you don't want to win. So if you have a family history of diabetes, and then you have are physically inactive, and then your diet's not the best because you don't have access to good quality foods, and then there's environmental exposures that could increase your risk for diabetes, and then there's other things. Each of those components are lottery tickets. As you get more lottery tickets, your chance of actually getting diabetes increases. So you want to minimize those number of lottery tickets, or those exposures, or those determinants that you have, to minimize your chance of developing that disease outcome.
That makes sense. That's a good way to put it. Thank you.
You're welcome. What other questions? And then what we'll do is we'll take a 5-minute break, and then I'll come back, and the rest of this is all sample problems. So I have We'll do some kind of polling. Hopefully it works. I'm using a different system than Zoom because Zoom was not working well. And then we'll go through some calculations. We'll answer questions. So any questions before we take a break until 10:35? Okay. All right. We're going to take a break till 10:35. If you have questions that you think of during it, feel free to chat them in. I'm going to pause the recording. If you don't see me on pause it, if it doesn't show that it's recording again, somebody please remind me so that I don't not record this whole second half of the session like I've done before. But I just don't want it to record us just sitting in silence for the next 5 minutes. So 10:35, we'll be back. Resume the recording. I didn't forget, but I'll wait just a moment before we get started. Okay, so we are going to now spend the rest of the time going through sample problems. I have some multiple choice questions. I have some short answer questions. If there are problems on the sample problems that are already posted on Google Courses that you have questions about, feel free to have me work through those if we have time. I'm happy to answer questions about homework questions or whatever it might be that you think you need help with or you want to go through problems with. I have a couple problems, as I said, on the causal inference, the necessary and sufficient. We have calculation problems and many, many others. And most of these, as I said, are previous exam questions. I did pull some off the sample problems themselves that you all already have access to. I posted a version of the PowerPoint that I'm going to pull up now for us to go through our sample problems on Google Courses earlier this morning, so you can pull it up. It doesn't have any of the answers in it. I will post the version with all the answers some point later today as well, so you have access to all of those too, so that as you're working through these later, you have the answers for everything that you need to do. So we are going to use a platform called Poll Everywhere. You may have used it in some of your other classes. It was the best one I could find. I normally actually, for these reviews, when we're in live in-person classes, I normally create a Jeopardy review session, and I have a Jeopardy game that's on my PowerPoint that we go through. I've tried to do it in these virtual sessions, and it just doesn't work very well because it's harder to like have people chime in or raise their hand and actually keep track of things. So we're just going to kind of do some normal polling and talk about the answers, look at the distribution of answers. And if there's things where like so I'm not expecting that you all have studied a lot at this point, but hopefully you've been reviewing the material as we go along, because if you haven't, then you are going to have a ton to review over this next week. So I'm not expecting everybody to just know all of the answers to all these problems. But if there's things that there seems to be a lot more confusion on, I'll spend some time reviewing those particular concepts as we get through them. And hopefully this will kind of be a helpful process for you to think through where you need to focus your studying and what you maybe know less than you thought you did and so on. So this should be showing up on your screen. We're going to use, like I said, Poll Everywhere. So you have two ways that you can respond to this. Is the first question. You can go to pollev.com/RichardArman112. And when you do that, you don't have to log in. You can put your name in there. You're welcome to. You don't have to. And you could just hit skip for logging in, skip for putting all your information in there, or you can put in a pseudonym. And then it should show you this first question. Or the other thing that you can do as we go along, if you don't want to do it on your computer, you could also pull this up on your phone. You can pull the website up on an iPad or anything. You could also text in, though sometimes the texting in is a little bit finicky, but you text to the number 37607. You first type in Richard Arman 112, and then you send the letter of your answer. Students often have variable success texting in their responses. So this is open now. I'll give it a few minutes for you all to go to the pollev.com, Richard Arman 112, and you can choose your answer. And I'm actually, in just a moment, I'll start showing the responses that you all are putting in and then we'll talk about the correct answer, the incorrect answer, and so on. So I see 2 people have responded, so it's working. That's good. See 6 responses. So the website is pollev.com. Here, I'll put it into the chat. It's on the slide as well. So you should be able to go there. Oops, I put an extra 1 in there. Let me retype that. See 8 responses, so there's 30 of you here. So we still have 22 people or 21 people left to respond since I'm part of that 30. Hopefully this one will take the longest as you all open up the program, and keep it open because it should, as I move through questions, you should be able to see the additional questions just pop up on your screen as I move forward on the slide. Oh, I realized I put the wrong thing a second time too. Thank you, Rosalind. Apparently I cannot type right now.
It auto-corrected when I tried to put it in again too.
Okay, that's what was going on.
And then on the slide, it's because on the slide it says start the presentation to see live content at the bottom. That's probably why it wasn't showing up on the slide.
Is it? Are you not seeing it on the slide?
Like I have the slide pull up on my iPad, but there's a bar at the bottom where it says like start the presentation to see live content for screen share software. Yeah, it doesn't show like the stuff.
So you can't see at the top of what I'm sharing my screen. You can't see the pollev.com.
No.
That's very odd because it's
at least
showing
for
up
me,
on.
I can't.
Interesting. Because it's definitely part of what I'm sharing on my screen, so I don't know why that would. Here, let me. I'm gonna exit out of this, and I'm gonna share it a different way. So give me 1 second, and that might alleviate any problems. Okay, what about now?
Yeah, I can see it.
Perfect.
Oh, come on.
Right, there's 25 responses. I'll give it about 30 seconds to 1 more minute for a few others to respond now that hopefully that is showing up properly for all of you. I really hate technology this semester. I think I've had more technology issues in the last 6 weeks than I've had in the last year. All right, so let me show responses. 85% B, 15% C. So B is the correct answer. And that's on the slide that I showed you all earlier in the review. It really is the foundation of public health because it addresses assessment, policy development, and assurance. So again, make sure you go through that slide. You know why it's the foundation of public health. You may need to describe that in a short answer. You may need to answer a question about it or something. So that's question one. Question number two. So hopefully that's switched for you in your Poll Everywhere program, and you should see something different on the share screen as well. And this one you have to do, you don't have to do any calculations. There are a couple where you do. Seeing 9 responses so far. Fourteen responses. Thirty more seconds. Seeing 21 responses. Make sure you're chiming in. Even if you don't know the answer, think about what it might be. It will be helpful as you study. I always tell students, even if you get the wrong answer, as we review, you'll remember why that is the wrong answer when you come to an exam question or you come to study. So it's better to shoot and miss and then to recalibrate than it is to just not try at all. All right, 27 responses. So I'm going to go ahead and show the correct responses. Which show responses is a little all over the place. So this is one where I'll provide a little bit more details. So 15% A, 44% B, and 41% C. So let's talk a little bit about the differences between infant mortality rate, case fatality rate, disease-specific mortality rate, and so on. So this question says, parents of an infant 9 months old diagnosed with a potentially deadly disease are very concerned about whether their child will survive the next 12 months. They should ask the doctor about which of the following. So what does the infant mortality rate tells us? The infant mortality rate is the number of infants under the age of 1 who died during that time period. So that would tell us of all infants who were born in that time period, how many died under the age of 1. So that does that tell me anything about the disease itself? And would that help the parents know, so my infant has this particular disease, what is their risk of dying? No, it doesn't, right? So that just tells me of all the infants, how many are going to die in this next time period. It's not disease specific. It doesn't tell me anything about that, the risk of dying from that particular disease. The correct answer here is B, by the way. So then the second one, let's go to C, disease specific mortality rate. So what does the disease specific mortality rate tell us? That is among everyone in the population. So the denominator for disease specific mortality rate is total population. How many people died from that particular disease? So again, what that tells us is in the entire population, and in this case, regardless of age and other things, what is the mortality rate from that one disease? So that tells me overall kind of burden of disease in the population. It's telling me that that disease might have a high rate of death in the population as a whole, but it doesn't tell me anything about an individual's risk of dying from that particular disease, especially within the age group that we're looking at. So while the disease-specific mortality rate is useful for examining rates of mortality at the population as a whole, it's a little bit less useful for looking at specific risk of something for an individual when we're evaluating them in a clinical setting. And that's where the case fatality rate comes in, where the case fatality rate is the number of deaths due to that particular disease over the number of people who have that disease. So if we're thinking about what do the parents want to know, they want to know of the other children who have been diagnosed with this disease, how many are dying? So if the case fatality rate is 95%, that tells me that's a very severe disease. So the case fatality rate is a measure of severity. The higher the percent of people who are dying, the more severe that particular disease is in general. It also depends on how many people this disease is affecting. So if the disease is only affecting 0.5% of the population, then when we're looking at it at a population level, it's not as severe. But when we're looking at it for those people who have that disease, it's very severe if the case fatality rate is 95%. If the case fatality rate is only 1%, that tells me that survivability after being diagnosed with this particular disease is really high, and that maybe we shouldn't be quite as worried about it. But again, that all depends on the context of what we're looking at. For these particular parents, if their infant was diagnosed with the disease and they were told the case fatality rate was 1% of the 2,000 people who get it every year, they could probably take a sigh of relief and say, okay, this is not that severe. My child is very, very likely to survive this moving forward. That doesn't mean that chance of not surviving is 0, but it means that there's a really high probability they're going to survive. So make sure you're understanding the differences between those kind of population level measures, which would be things like infant mortality rate, which is really an age-specific mortality rate because it's the number among those who are 1 year or younger, how many are dying, versus disease-specific mortality rate. Those are all kind of population level calculations and tell us less about the actual group that have that disease. That's where case fatality rate comes in. The other measure that we have here is proportionate mortality, with proportionate mortality being among all of the deaths in the population, how many die from that disease. So that's not a very useful measure for individual health. That's a better measure for burden of that particular disease. So if 50% of the deaths in the population were from one disease, that tells me that disease is a high burden on our population, and we need to put into place strategies to control and prevent and treat that disease to prevent the high proportion of deaths from that one particular disease. And this is where the leading causes of death in our population come in, where I showed you that list a few weeks back that showed these are the 10 leading causes of death in the population. And that list was actually on homework number 1 too, where you were able to calculate proportionate mortality, I believe, of Alzheimer's, and say of all the deaths in the United States in 2019, how many were due to Alzheimer's? So again, that tells us kind of the burden of that one disease in relation to all of the deaths in the population. And then population mortality rate, that's just crude mortality, another way of saying it. So again, that just tells us what's the mortality rate in the population as a whole. That doesn't tell me anything about individual risk or burden of a particular disease or anything. So make sure you understand the differences between those. Make sure you're able to plug in the numbers into the formulas and identify the right numbers and do those calculations. Next question. See 10 responses. I'm going to give you about a minute for each question for responses. Some of them I might give you a little more if they require a little bit more, but for ones like this, I'll give you about a minute. Seeing 20 responses. 22. All right, I'm going to show the responses now. All right, so responses are a little all over the place again. So endemic, epidemic, and syndemic. So syndemic, we actually haven't really talked about in this class. Syndemic really means when diseases occur together or things are happening in tandem, they're syndemic. So that's not a concept that we really talked about. It's common, but it is not one that you will have to worry about. I just kind of threw that as a red herring answer. So difference between endemic and epidemic. Remember, endemic is that normal steady state of disease and the number of cases that we'd expect to see in any given amount of time. So in this case, it says about 800 cases are reported each year. Epidemic means that we are seeing a higher number of cases of disease than we would expect to see in that given period of time. So does anything in this scenario tell you that we're seeing a higher rate of disease than we would have expected to see, which is that 800 cases?
No.
No, so this would be endemic. So that means rickettsial disease or rickettsial rickettsii or Rocky Mountain spotted fever, as I have it here. It is actually a real tick-borne illness that causes a rash all over the body. It's actually endemic in San Diego County and in Southern California and in the Colorado Rocky Mountain region. And it's kind of similar-ish to Lyme disease being a tick-borne disease, but it's endemic in the United States. And we see about 800 cases. If it had said, normally we see about 800 cases, and last year there were 1,500 cases, or last year in San Diego County, there were 500 cases alone, then that would indicate potentially that there was an epidemic of Rocky Mountain spotted fever. So you're kind of looking for those pieces of information that tell you about what we would expect to see and whether or not we're seeing something different. Next question. So I'm going to stop showing the responses because I want you all to not see what other people are responding while you're thinking through your own response. Seeing 14 responses, 15, about 30. This is a little bit more challenging of a question. As I mentioned before, we'll go till about 11:30, but I do want to start going through some of these multiple choice a little bit quicker so we can get through some of the short answer questions. And I may just skip a couple of the multiple choice questions so that we can do that. All right, see 23 responses, so I'm going to go ahead and show the answers. So we are split. Where we're seeing prevalence, 5-year survival, prevalence, and incidence. So what does this scenario tells us? Tells us that there's a new drug, there was a rapidly fatal form of cancer, and this new drug treats it. So this is having you think about what things affect really incidence and prevalence of disease. 5-year survival rate. So let's think about, will this be affected? This drug is better treating a previously rapidly fatal cancer. So the 5-year survival rate will be affected because more people are going to be living longer because there's a better treatment. So that one would be affected pretty greatly by this new drug. Prevalence of this type of cancer. So what happens to the prevalence if people are surviving longer with a particular disease? It goes up. So in this case, the prevalence would be fairly drastically affected by the new treatment, because more people are going to survive longer. We're going to have a buildup of cases and our prevalence is going to increase. Nobody selected mortality rate for this. The mortality rate would be affected. So it's good you did not select that. The mortality rate would be drastically affected by this, because if people are surviving longer, mortality rate is going to go down in any given time period for that particular disease. And the last one, C, which is the correct answer, incidence rate for this type of disease. Why won't incidence rate be affected if we have a new treatment for a disease? It's a chronic disease. It's not communicable. Most cancers you don't pass on to other people. There are some, but so incidence won't be affected because this new treatment has nothing to do at this point that we know of with the development of that disease. So we would expect to see the incidence rate to largely remain the same in the population, because we haven't done anything to, at least in this scenario, to change the rate of new development of this particular cancer. So the incidence rate would be least affected by a new treatment, because that treatment has to do with once people already have it, and incidence rate is our risk of disease, that development of new disease. So again, this is thinking through what affects prevalence, what affects incidence. So make sure you're going through those slides to look at those. I'm going to skip this question just for sake of time, because it's a fairly easy one. What is a vector? But just make sure you know what a vector is. So a vector is a living insect or animal involved with transmission of a disease agent. That's part of infectious disease epidemiology lecture. So let's go to this one. This one, you do have to do a short calculation. We just talked about infant mortality rate. This is not the exact same question as what was on your sample problems, FYI. So if you've done the sample problems or you have them open and you're answering it, it is similar, but there's one thing that changed. So make sure you're looking at that. If you need it, the formula for infant mortality, number of deaths of infants under the age of 1 over the total number of babies that were born. So number of deaths under age of 1 over the total number that were born. Seeing 10 responses so far. Give you about 20 more seconds. So I have a question it was a direct message, but for the multiple choice, we can go over more multiple choice questions during other review sessions. We can go over short answer. The other review sessions I run fairly openly, to where you all, ideally you all would come with questions and say, let's go over this or let's go over that. And I will happily do that. Those ones are only an hour long. And so we may not be able to get through everything that you all want to, but yeah, we can go over whatever you want, whether it's additional multiple choice questions that I'm not going over now, sample problems, concepts in the class, whatever it is. All right, I'm gonna go ahead and show the responses. There's 20 right now, but that's okay for the sake of time. Just make sure you're able to do these calculations, and you don't have to be able to do them necessarily really quickly. And I know that you're all still studying, but if you're finding yourself on a question like this, having to take 10 minutes to calculate infant mortality, then that might be an area where you can study and make sure you're understanding the formulas and what to plug in the numbers. Because if it takes you longer than 3 or 4 minutes per question, you will run out of time on the exam. So this is the point of some of this review, is helping you focus, like this is the types of things you're going to see. So make sure you're comfortable with that. Whoops, let's see. So C, most people got the correct answer. So the answer would be 3. So there were 3 infants that died before the age of 1. It does say 3 children, 2, 3, and 7 died, but they were over the age of 1, so they don't count in this calculation. So 3 divided by that 100 babies who were born would be 0.03, and then you multiply that by 1,000, and that gives you 30, infant mortality rate of 30 per 1,000. So make sure you're comfortable with that. This should be a quick one. Cross-sectional studies allow you to infer the temporal sequence of exposure and disease, true or false. Got to remember to not have the responses up. And I want you all to change yours because you see another response. I'll give you about 15 more seconds on this one. It's true or false. So the true or false ones are meant to be like, quick, here's the answer. Remember temporal sequence. Temporality means timing. So can you assess the timing between exposure and disease? I'm going to show the responses. So the correct answer is actually false. So we did talk about this earlier in the review, where one of the limitations with cross-sectional studies is that we don't know, because we're asking people about their exposures and their disease status at the exact same time on a survey, we don't know what came first. So that's the example I talked about earlier, where it could be that a person who was diagnosed with diabetes started working out more frequently. So if that was the case, and a lot of people who were diagnosed with diabetes started working out, if on a singular survey we asked them, how often do you work out? And have you ever been diagnosed with diabetes? And they say really often and yes, that would look like working out a lot is associated with type 2 diabetes. But that what really happened is that they were diagnosed and they started working out. So we're not able to assess the timing of what those exposures and disease outcomes look like when we're only assessing it at one point in time. We have to do cohort studies to look at the timing, and we'll talk about those after the midterm exam. So make sure with all of these types of studies, whether it's cross-sectional, ecological, case report, or case series, you kind of know those major points about them that are on the slides to ensure that you feel comfortable answering these types of questions about them. All right. So the next question is about the disease causality. So here's an example of one. What is the causal relationship between sugary sweetened beverages and type 2 diabetes based on this scenario? See 14 responses. I'll give you about 30 more seconds. think about what type of disease is type 2 diabetes. Chronic disease. So what have we talked about? So for some of these, if you look at the disease outcome, you can come up with an answer sometimes, not always, but sometimes fairly quickly based on what the disease outcome is. Not always, so don't always rely on that, but that gives you at least some clues. Seeing 22 responses. So I'm going to go ahead and show the responses at this point. Right, so it's neither necessary nor sufficient. So remember, for most chronic diseases, the causal relationship is neither necessary nor sufficient. Not always. That's not always the case. For example, cervical cancer. We know that HPV, the virus, can lead to cervical cancer. So while cervical cancer is a chronic cancer disease, it's caused by a virus and infectious disease agent. So the causal relationship there looks a little bit different. It's not always going to happen. So it's not necessarily sufficient, but there's a different causal relationship there. And there's a lot of other examples of things like that. But drinking sugary sweetened beverages might increase a person's risk of developing diabetes. It's one of those lottery tickets they might have, but it's not necessary because many people who develop diabetes never, don't drink sugary sweetened beverages, or they really drink them on a limited basis. And there are other factors that are listed here. People who have family history diabetes, people who are physically inactive, among many, many other things that lead to type 2 diabetes. So this is a case of neither necessary nor sufficient because there are many factors that can lead to disease, and every case of type 2 diabetes is unique in some way. So that's the causal relationship there. All right. I'm going to skip through a couple of other ones. We'll go through some of these other ones, and you have them in your thing. We'll go through them in the review as well. And there's another causality one. All right, so here, this is out of your sample problem, so I'm not going to go through this right now. Let's do this one. So this is a calculation problem. Given the data below, what is the mortality rate from cancer among Hispanics in Florida in 2015? This is no longer on Poll Everywhere. This is just on the slides on what I'm showing you. Because for some of these calculation problems on Poll Everywhere, it doesn't work. So you can close out Poll Everywhere. We're done with that for today. And we're going to just do problems that are only on the slides. So I'll give you about 2 or 3 minutes to calculate. If you need the formula, mortality rate is equal to number of deaths. And this is, so one of the things you'll have to figure out is what type of mortality rate is this? Is this just a crude mortality rate, or is this a cause-specific mortality rate, or what is it? So this is a cause-specific mortality rate among Hispanics in Florida. So number of deaths among Hispanics in Florida in 2015 over total population. And I'm giving you more information than you'll have on the exam right here. The general formula that you have is number of deaths over total population. Your total population, remember your denominator, is only Hispanics in Florida in 2015. So make sure that you are pulling the right numbers. Yeah, per 1,000. Sorry, I should have had that on the slide. Yeah, you can chat in your answers if you'd like. Perfect. So right, so your numerator is 6,101 because that is the number of deaths due to cancer in 2015 among Hispanics. And then your denominator is the Florida population in 2015. And so only Hispanics. And so it'd be 6,101 divided by 4,548,426, or 1.34 per 1,000. And I see some of you chatting in the way that I would like you to format the answers. I like that you're chatting them in this way. In 2015, among Hispanics in Florida, there were 1.34 deaths due to cancer per 1,000 people in the population. So having a sentence to describe your answer is important because it tells us all that context that we need. All right, next one. So let's go over this because, as I said, this is going to be on the exam. Please make sure that you are comfortable going through and answering a question based on this scenario. So I'll give you about 5 minutes to work on this on your own. The questions that you'll answer: how many person years are contributed from October 1st, 2004 to September 30th, 2005? And what is the incidence rate per 1,000 from October 1st to September 30th? So calculate the number of person months, contribute that to person years, and then calculate the incidence rate. While you work on that, I will be right back. I'll give you about 1 more minute. And then we'll talk through. Yeah, so about 45 more seconds, and then we will go through the answer for this. You all can hear me, right? I have one student chatting saying they can't hear me. Okay, good. I was like, I'm not getting any responses. Maybe no one can hear me, and I don't know. Okay. So for the sake of time, I have the answer kind of popped up on the slide. I'm not going to work through it line by line. So first thing that you need to do is you need to calculate the number of person months that are contributed by each of the people. So remember, there's 40 people in the population, and 10 of them are represented in this figure. There are 30 people who are healthy for that entire time period. So the first off, you have 30 people who are healthy for 1 year. So they contribute 30 person years. Those are just included in your calculation that you do. And then you have to count up the number of months that each person in this figure contributes. So for example, person 1, they're healthy on October 1st. They're healthy for 1 month. They get sick, and they're sick for the rest of the time period before they pass away. So they contribute 1 month of time. Person 2 is sick at the start of the time period, and then they pass away before April 1st. And then none of the rest of these months count because they're no longer alive. They no longer contribute risk. So you want to go through and count up the months that are contributed on each level. So what you would end up with, now these aren't going to show up correctly, is 26 person months total. So let me go here. So let me go 1 more forward. This is going to show you the whole answer. So this gives you, on the right-hand side, each of the person months that are contributed by every single person by counting them up. So make sure you got those same numbers. You should have had 26 person months total. You divide that by 12 to get 2.17 person years. You're dividing it by 12 because there are 12 months in a year. So that converts your person months to person years. And so that 2.17 is the amount of time at risk that the 10 people in the figure contribute. We add those to the 30 person years that the 30 people who are healthy for the entire year contribute. And that gives us 32.17 person years from October 1st to September 30th. Then for the incidence rate, what you do is your incidence rate, the formula is the number of new cases over person years at risk. So you just calculated the denominator, which is that 32.17. So then what you do is you count up the number of new cases. So we have 1, 2, 3, 4, 5, 6 new cases from October 1st to September 30th. None of the cases that happened before October 1st count because they happened before the start of the time period that we're doing our calculation for. So you do 6 divided by 32, you multiply that by 1,000, and that gives you 186.51. How's everyone feeling on this? You've now done it 3 or 4 times, so hopefully you're feeling okay on it. The other thing that you may have to do, or that you will have to do, is I might say, what was the prevalence of disease on April 1st, 2005? So you can calculate that right now if you want. What's the prevalence of disease on April 1st, 2005? What you would do, count up the number of red lines that cross April 1st, because that means the person was sick at that point. So 1, 2, 3, 4, 5, 6, 7. And then you divide that by the total population. We had 2 people who passed away before April 1st. So they have to be removed from the population of 40 people. So the prevalence would be 7 divided by 40, and that would be calculated as a percent. So that would be the other way that you'll be asked to use this figure. Any questions on that before we move to our last sample problem for this session?
The first and the last column don't count, right? Like when we're counting the months.
Correct, yeah. So this very first column here, that's before October 1st. So that's gonna actually be September. And then this very last column is gonna be October of 2005. So those don't count. But I just have those there to indicate the timing so it makes it a little bit more clear. So those lines can go across it. What other questions do you all have? Okay, so again, make sure you're comfortable with this. You're going to see something very similar. The lines and the arrows and the crosses are going to be in different places, but this should be, you get to this question on the exam, you've done it 10 times. You're like, this is going to take me 5 minutes to do because I know how to do it. I count the boxes, divide by 12, add that to 30, divide that by the number of people who got sick during that time period. Should be a fairly quick, straightforward, hopefully. If it's not, if it's Monday and you're still struggling to get through one of the sample problems like this, please contact me so that we can meet and go through it. I cannot help you if I don't know that you need help. All right, last sample problem, and this is to calculate an odds ratio, and I guess I don't have that on here. So scenario is a community advocacy group is concerned over agricultural pesticide use. They believe young infants and children are being exposed to high levels of pesticides through cross-contamination from parents who work at nearby farms. They survey 15,000 families with infants between the ages of 1 and 3, where at least one parent is asked about, one parent works at a large farm. They ask them about their exposure to pesticides and ask about children's neurological disorders at the same time. In total, 10% of parents report that they have been exposed to pesticides. In the study, 420 families report that their children have a neurological disorder, of which 378 had at least one parent that reported being exposed to pesticides. So what you'll have to do is calculate a prevalence odds ratio to determine if pesticide use is, sorry, I'm typing it up, associated with neurological disorders. So there's your question. I just put it in the chat. Calculate a prevalence odds ratio to determine if pesticide use is associated with neurological disorders. I'll start kind of silently going through it myself in about 1 minute. So try to move ahead of me so that you can come up with the right answer and make sure you're going through the steps, but I'll start going through the steps as if you need refreshers. Oops. That's my attempt at a 2x2 table using my mouse, so ignore that it's lopsided. So you should have a setup where you have a 2x2 table with neurological disorder on your columns, because that's our outcome of interest. And you should have pesticide exposure on your rows. It's okay if you put pesticide exposure no on the top and yes on the bottom, and we'll talk about that at the end. But you should just have either no pesticide exposure or pesticide exposure on the top and then the opposite on the bottom. Then the other thing you need to do, you have 15,000 parents. It says 10% reported that they were exposed to pesticides. So you just have to calculate the number that were exposed to pesticides. And oops, I put 15,000, that should say 1,500. And apparently this doesn't let me edit. Yeah, this should say 1,500. Let me erase that. And oh, dang it.
Professor, I have a question.
Yep.
It says that in total, 10% of parents report that they have not been exposed to pesticides. Should that say that they have been?
Oh, shoot. Yeah, not, that says not. I was just reading that wrong myself. So this is not exposed. Sorry. Thank you for pointing that out. So then I'm just going to slowly start kind of filling in numbers on the table. Where does my 1,500 not exposed to pesticides go?
Would that be B or C plus D?
C plus D. So then that means what is going to be A plus B?
Is that 13,122?
Well, it'd be whatever 15,000 minus 1,500 is.
Oh.
So it'd be 13,500. And then my scenario says 420 families reported that their children had a neurological disorder. Where does that 420 go?
A plus C.
So then we would do 1,500 minus 15,000 minus 420, which is going to be 14,580. And then it says, of which, of those 420, 378 had at least one parent that reported being exposed to a pesticide. So where does that 378 go?
A.
A. So of the children with a neurological disorder, 378 of their parents had pesticide exposure. So that's the overlap of A. Yes, and pesticide exposure is A. So then we would do, to fill in C, 420 minus 378, that equals 42. And then to get B, we would do 13,500 minus 378. And that's 13,122. And that's what you had said earlier. I forget who said that. And then the 1500 minus 42, and that equals 1458 goes there. So does everyone see how we filled in this 2x2 table? Does everyone feel comfortable and like they can do that? Because you will have to do it at least once on the exam. Okay, I'll take the silence as a maybe or a yes. If you're not, please let me know, because again, you're going to be tested on something like this. So then you have to calculate a prevalence odds ratio. That prevalence odds ratio is equal to AD over BC. So prevalence odds ratio is 378 times 1458 divided by 42 times 13,122. So let me calculate that.
Is the answer 1?
So you will come up with 1. What does that tell me about the relationship between pesticide exposure and neurological disorders?
Is it that they're equal?
That there's no association, so that having a parent who is who is exposed to pesticide is not associated with a child having a neurological disorder. So remember, a prevalence odds ratio or a prevalence ratio equal to 1 means that there's no association. We have the same proportion of children with a neurological disorder among those with a parent with pesticide exposure as we have among those without pesticide exposure. So that is equal to 1. If our prevalence odds ratio was, say, 2, that would have told us that children who have parents with pesticide exposure are 2 times more likely to develop a neurological disorder. Or if it was less than 1, they would have told us that children with parents who have pesticide exposure are less likely to develop a neurological disorder than those who don't. What type of study is this describing?
A cross-sectional study?
It's a cross-sectional study. How did you determine that?
Because we have 2 different factors being related to each other, pesticide exposure compared against neurological disorder.
And how do we collect that data? That's perfect, by the way. How do we collect that data?
Via like surveys?
Survey at one point in time where we asked about pesticide exposure and we asked about their children's neurological disorder. So even if there was an association, we wouldn't know whether or not those children already had a neurological disorder before their parents ever started working and were exposed to pesticides. So again, this goes to that this is a cross-sectional study. We don't know anything about the timing of the disease and the outcome and so on. So for this, the interpretation is there's no association between parents' pesticide exposure and children's neurological disorders. Any questions on this? How are we feeling? So we just went through some review. I would have ideally liked to have gotten through more, but this takes a lot of time to go through problems and explain them and come up with answers. But how are we all feeling? What do you all need at this time? Feeling good, need more help, going to attend the review sessions, you're not sure.
What time again did you say the review was tomorrow? Like I'm feeling like somewhat confident with it, but I probably want to do some more review tomorrow.
Tomorrow the review is at 1, I believe.
Okay.
They're posted on Cougar courses. So don't take my word from it because I don't remember off the top of my head. Cool. Well, I will take silence as hopefully you're all at least feeling somewhat comfortable and ready to study, and you've maybe identified some areas where you need to study a little bit more based on this review. I hope this was helpful, and that you're all able to get some good studying in. Make sure you get good sleep. Make sure you reach out to me if you have questions. If you're not able to attend the additional review sessions, let me know. I'm happy to meet individually. I want you all to do well, so please keep in contact. And otherwise, I'll either see you in the reviews over the next few days, or I will potentially see you next Wednesday if you attend the kickoff for the exam. You don't have to. That's just to kind of get it started and answer any last minute questions. And then as always, if you have any questions, email me or reach out to me anytime. But otherwise, have a great rest of your week and weekend. Relax, have some fun, don't study too much, step away from your studying so that you can process all the information and go from there. Do the sample problems, they'll be helpful. And biggest advice, do the sample problems before you look at the answers. If you're working on the sample problems and you continually are having to look at the answers to help you go through them, when you get to the exam, you're not going to have the answers as a crutch to be able to look at to help you get to the next step. So make sure you're able to do problems independently without the answers there. Otherwise, have a great rest of your day. I'll stay on here for a couple minutes if anybody wants to ask any last minute questions individually, and I will talk to you all soon.
Thank you, Professor.
Thank
Thank
you.
you, Professor.
Thank you.
Yeah, I will see you tomorrow in the review session, and I hope you have a good rest of your day.
Thanks, Trent. You too.